Well, hello to everyone watching and listening in today, and thanks for joining us for what we hope will be a very helpful conversation about a topic that creates a degree of confusion year in and year out. That's Medicare and health insurance. That can be especially true for people moving from full-time working years to something like retirement. I'm Kent Kramer, and I serve as the Chief Investment Officer at Foster Group. We're a wealth management firm based in West Des Moines, Iowa. Foster Group also has a team in Omaha, Nebraska, and we have clients all over the United States. Today, I'm joined by two experienced advisors to help us understand Medicare and what we'll need to do, especially those of us who are nearing age 65 and contemplating retiring from the traditional workplace, or maybe we've been participating in group benefits like health insurance as well as dental and vision plans during our careers. So let me introduce our advisors. First, Ashlee Vieregger. Ashlee is a senior lead advisor at Foster Group, working with individuals and families, and she assists them with everything from retirement planning to advanced estate and philanthropic plans, as well as developing long-term investment strategies. But she also has become a Medicare wizard, both by curiosity and by necessity, since every person in the U.S., including the clients she works with, will be making Medicare-related decisions at some point. Our second guest today is insurance professional Aaron Peterson. Aaron owns AKP Health Insurance in West Des Moines and has over 20 years of experience helping individuals demystify and navigate the ever-changing world of health insurance. Aaron has been voted the best local insurance agent in CityView's Best of Des Moines poll, and at Foster Group, many of our advisors enjoy a great working relationship with Aaron, helping mutual clients get the personalized solutions in place that's going to work best for them. So, thank you, Aaron and Ashlee, in advance for what I'm sure is going to be a super helpful conversation today.
Great to be here, Kent. Thank you.
Thanks for the opportunity.
Yeah. So as we prepared for today, we've decided to break our conversation into 5 basic sections that we hope will get at the most common questions we hear from our clients. Now, a personal note, as we were preparing for this, I realized that I am in the primary audience for this webinar as well. I'll become Medicare age eligible during 2026. So as I ask the questions, know that these are my questions as well as yours. So here's the outline. First, what is Medicare? Second, when will this matter to us? Third, what about health insurance for myself or my spouse before Medicare eligibility? Fourth, what are the options and the key decisions that we'll need to make? And fifth, how much will we pay for it? All right, so Ashlee, let's start with you. I know one of the things as we were preparing for this, we talked a little bit about the differences between health insurance and Medicare. It seems like there might be a little bit of confusion as to what exactly Medicare is and how it differs. So tell us, what is Medicare officially?
Officially, Medicare is a health insurance plan meant for folks who are age 65 plus, sometimes folks who are a little younger if there are certain disabilities involved. And what makes Medicare really unique as compared to the way that a lot of working adults access health insurance through a group plan or through the marketplace is that it's an individual policy. So it's not covering you and a spouse or a family. Medicare is one-to-one. Both spouses would have a Medicare policy if they were both over 65.
I think that's the thing that caught me.
Yes.
You're talking about
it's very different.
Individual, yes.
That's right. And the second thing about Medicare that makes it distinct from almost any other form of health insurance, especially if people have been accessing it through the workplace, is that the premium cost per month is income-based. So lower income earners would have lower premiums or a lower entry point, and higher earners would have higher premiums per month. That's pretty distinct from other ways that most people access health insurance.
Okay. So that gives us a little bit about what it is. Now, I mentioned I'm going to be turning 65 this year. So one of the things that I've thought a lot about, and I think others do too, is when do I need to be making decisions? What do I need to do at what point to make sure that I don't miss out?
Yes. Well, being a timely entrant to Medicare is very important. And for most folks, there are 2 primary lanes that one would use to enroll in Medicare for the first time. The first and most straightforward is based on your birthday. It's called an initial enrollment period, and it runs for a total of 7 months. The 3 months before you turn 65, the month of your 65th birthday, and then the 3 months following your 65th. So as long as you're enrolling in Medicare when you're first 65 during that 7-month window, you would be considered a timely entrant, which is important for premium purposes. That's lane number 1. Lane number 2 is going to be, well, what if I have made it to my 65th birthday, I'm still working, I'm still going to be covered by my group health insurance plan, and I don't intend to enroll in Medicare until I've retired and my group coverage has ended. That is perfectly okay. Tons of people do it. We would make use of what's called a special enrollment period. So if you're retiring after 65, you're leaving group health insurance coverage through your employer, you have 8 months after group coverage ends to enroll in Medicare, and you would still be considered a timely entrant, which is important for premium pricing. So it's very important that you know which lane you are going to use when it comes time to enroll in Medicare for the first time.
All right. That is very helpful. Just those windows of time. We do have some time, but it does kind of make us pay attention, especially in that year when we're going to be 65 or in the year that we're going to retire, that we're thinking about.
Well said. Exactly.
Okay. All right, Aaron, your turn. We talked a little bit about, what the plan is, but people are going to come at it in different ways. So what I'm thinking about is, let's say a person is going to retire before age 65. So they're 64, they're retiring a little bit early. So before Medicare eligibility, what are their options to kind of bridge them from retirement to that Medicare eligibility?
Yeah, good question. So the most common way that people would do that is they would take their COBRA. So COBRA is basically your group insurance plus a 5% surcharge. You can keep that for 18 months. And that's for a long time what people did. Now that we have the federal marketplace, since 2010, we have the Affordable Care Act. And the Affordable Care Act says that they cannot use any health history against you. So in most cases, when we have people that are sort of going either COBRA or marketplace, they're looking at the marketplace. If you're under 400% of the federal poverty level, which for a single person is $62,600, for a couple, $84,600. If they're underneath that, they're going to qualify for a considerable subsidy. That's basically a coupon that they can apply each month off their health insurance premiums. And many times that's where people are opting if they have that offer. We do have some folks that perhaps they're making more money than the 400% of the federal poverty level. And for the right person, there are private plans. Those private plans have some things that you need to filter through. For instance, if you have some pre-existing conditions, they may not be the right fit. But for a healthy person that basically has decent health, they can offer some savings from a marketplace plan that you would get without a subsidy.
Yeah. So Aaron, one of our calls prepping for this, we talked about the differences in coverages and costs between, plans that are in the marketplace and private plans especially. Are there some differences that people should be aware of or at least on the lookout for in thinking about that?
Yeah, the main thing that you're going to want to look at is if you take an Affordable Care Act compliant plan on the marketplace, there are certain protections that are built into those policies. They can't ask you any questions about your health. The only thing that they can rate you up for as far as the price goes is your smoker status. So that's the only thing that you have to think about with your health. Affordable Care Act compliant plan is going to have free preventative care. So your mammogram, your pap smear, your colonoscopy, as long as those are coded as a preventative exam, you pay nothing with any Affordable Care Act. Doesn't matter what your copay is, your deductible, your out-of-pocket maximum, it's always going to be free. When you look at private insurance, oftentimes what the private plans are doing is carving out some of those protections. So I don't need all the bells and whistles. I don't need the Cadillac. I just need something to make sure that I don't go into any sort of catastrophic financial straits here in the next 12 months.
Yeah. Okay, so we've talked a little bit about what Medicare is. I think of it as kind of like the alphabet soup. It feels like there's so many letters or options around Medicare that I think sometimes it just sounds daunting. And this is, Ashlee, I'm sure why you've become so curious and the wizard that you are, because there's plenty of people who, when they're exposed to it the first time, they just have lots of questions. What are the coverages and what kinds of decisions am I going to be prepared to make? So tell us a little bit about that.
You bet. It's one of the most common questions I get asked when I'm working with an individual or a couple who are Medicare eligible for the first time. And I think what I would tell you is that Medicare isn't necessarily difficult, but what it is for most people is unfamiliar. They've never approached it, they've never seen it, they've never experienced it, so it all seems very alien and something that they're not familiar with at all. So really, when it comes down to it, there are again two lanes to accessing types of Medicare. The first and most common is called Original Medicare. There are 4 pieces to it. I use the example of a chair with 4 legs to describe the 4 component pieces of Original Medicare. There's also a bundled plan called Medicare Advantage, which we'll touch on in a moment. But Original Medicare typically has 4 pieces. Part A, which covers hospital stays. So if you're ever in the hospital for a surgery or admitted on an inpatient basis, Part A is going to be your coverage vehicle for that kind of treatment. Part B is your medical coverage. So this would be your primary care doctor, any specialists that you might receive, outpatient treatment, lab work, etc. This falls under the umbrella of medical coverage. So that's 2 of our 4 legs of the chair right there, hospital and medical. Those 2 pieces have limits on what they will pay from a coverage and benefits standpoint. And so a whole industry has cropped up to say, well, when those 2 have exhausted coverage, A and B, you're done. What about additional costs and needs during retirement? So the third leg of the chair is a supplement. And there is a plan menu, and there are maybe a dozen different choices, and they too all have letters to delineate the names of the plans. So plans A through N are available on a supplement basis. These are also known as Medigap plans. If you hear those 2 words, they mean the same thing, supplement, Medigap. They're used interchangeably. They are essentially an insurance that just lays on top of parts A and B that will extend where they leave off so that there's not a gap in coverage for folks in their retirement. Okay. And then the last leg of the chair, of course, is Part D. This is the easiest one to remember because D, if you think of D like drugs, prescription medicines, that's what Part D is going to cover. What makes Part D a little bit unique as compared to Parts A and B, which are standardized, and a supplement, which there are 12 or 13 different choices, Part D is very dependent on a person's individual medication list. So the same plan could be a great choice for one spouse and not so much for the other because their medication list, the prescriptions that they're taking, could vary wildly between them. Those are the 4 pieces, 4 legs of the chair.
A, B, C, D.
And then, okay, that was Original Medicare, the first lane of accessing Medicare. There's also a second lane to access Medicare, and we would call that Part C. Okay. That is very commonly known as a Medicare Advantage plan. It's going to wrap those 4 component pieces, A, B, a supplement, and the drug piece, into one plan. Essentially, this bundled offering functions like an HMO, and it can represent an interesting choice when you're comparing, do I want to go with Original or do I want to pursue a Medicare Advantage plan? Certainly costs and benefits, ups and downs, pros and cons to each.
So Aaron, in your experience, I know when we've talked about this, when you get into doing it with I'm going to take the A, B supplement and the D, there's lots of different carriers and options who are providing that supplement type. How do we evaluate what's a good supplement or provider for us?
That's a good question that our clients ask a lot. So for your convenience, all of those, a G plan, for instance, or an N plan or an F plan for some folks, those are all the same. So there's 36 companies in Iowa right now that are selling a G plan. Every G plan's exactly the same.
And the G plan this is a Medicare supplement or a Medigap type G. And if we look at G, and if there's any insurance company selling a G in Iowa, they have to basically offer the same benefits.
That's right.
Okay.
They're all standardized to make it, convenient and easy for you. The only difference is really the customer service experience you have with the agent and the company, and then the premium that they're charging. And there's, various different ways that insurance companies price those plans. But, as far as, a common question people will ask is, well, if I get a G plan, will my doctor accept it? The easy answer to that is, if your doctor accepts Medicare, they're going to accept your Medicare supplement. Okay. Now, I'm just talking about traditional Medicare supplements. When you get to a Medicare Advantage, then the network, the size of the network is a little bit more of a pertinent question that you need to ask. But on traditional Medicare, every G plan is going to be accepted at all the same places. The range in price on a G plan, as I refer to G because that's probably the most common one that people are asking for right now. I would say on the low end, and I'm just speaking for Iowa, depends on what county you're in. Probably on the low end, just under $100. On the high end, you might see that is as high as $200. So there is some variability in the price. And that's something that if you're working with an agent, most agents are probably going to have a number of different carriers that they offer for you. So they should be able to give you a few different prices with a little bit of price history as far as, is this company more volatile than the next? Have they had bigger increases? Those sorts of things.
And what causes, so for the same type G supplement, what would cause the premium to be different?
Yeah, I mean, there's a lot of different factors, and I need to say I'm not an actuary and never stepped near an actuary class. But, zip code is one thing. One thing I learned early on as an insurance agent is folks in rural areas are not as frequent users of medical care in general. And so typically you're going to see rural areas are going to cost a little bit less on a Medicare supplement. But every company, once you're outside of those guaranteed windows that Ashlee mentioned, then you're subject to underwriting if you want to buy a Medicare supplement. So for instance, let's say you take a very inexpensive plan at 65, but this company happens to be a little bit volatile in the price, and by the time you turn 70, you're paying double. And then you say, well, I know there's other companies, so let me go out. So part of you applying for a new insurance plan is that these companies can ask you underwriting questions. And so I'm making a generalization, but the companies that are maybe a little bit more picky in who they take typically are ones that maybe are controlling their price a little bit closer. Yep. Again, that's a generalization. Also, the size of the pool that are being insured matters. There's a lot of different factors.
Yeah. So on becoming initially Medicare eligible, Ashlee, you're talking about there's A, B. Those don't seem like they're subject to underwriting in terms of health costs, something like that.
Correct, they are not.
Okay. But then the supplements, are they subject to underwriting even on initial application at age 65?
Great question. So as long as you're applying during that initial enrollment period based on your 65th birthday, or that special enrollment period after turning 65 and leaving employer group coverage, that 8-month period, as long as you're using one of those two timely periods, you would not be asked underwriting questions by your Plan G carrier. Okay. If you were switching lanes after 65, as Aaron mentioned, then that's where those health history questions and resulting premium realities start to come into place. So the moral is choose well the first time so that you aren't backtracking and inadvertently exposing yourself to health underwriting questions that would make you an unfavorable candidate from a premium pricing perspective.
Okay. So let's talk about that initial enrollment just a little more, because I know in our conversations kind of leading up to this, we talked a little bit about the Medicare Advantage and then the regular Medicare sign-up. And one of the things that I heard from you, Aaron, is like, well, you want to be careful, just what you said, Ashlee, about, because when you enter one to exit that one and go to the other, now you're exposing yourself potentially to underwriting.
That's right.
So Aaron, you talked a little bit about maybe the care someone should take if they start with Medicare Advantage.
Yeah, I think if you're being really prudent and conservative about it, you would probably start off on traditional Medicare. And the reason is, if you start off on traditional Medicare, you can always switch lanes, as you put it, to a Medicare Advantage plan during the annual enrollment period, which is every October 15th through December 7th.
Okay.
So let's say I start at 65 on traditional Medicare A and B, and then I take a Medicare supplement, and then let's say, 7 years later, that Medicare supplement becomes unaffordable. During the open enrollment, I can switch to a Medicare Advantage plan. Conversely, though, if you start on a Medicare Advantage plan, and let's say you're in it for 3 or 4 years and something about that plan doesn't work, perhaps a doctor that you need to see, a specialist that you need to see doesn't accept that Medicare Advantage plan, you say, oh, shoot, I need to get back to original Medicare. You can always switch back to original Medicare in that annual enrollment period. You can switch back to A and B, but you're not guaranteed issue into a Medicare supplement if you're past a certain amount of time. So, yeah, if we typically, and we have our own biases, but we typically would say if that $120 premium for your Medicare supplement isn't a barrier, it's not taking groceries out of your refrigerator or clothes off your back, let's start on original Medicare, and then we can evaluate Medicare Advantage later. Now, every broker has their own thoughts on these things, so I'm not here to necessarily, we have our philosophy, right? And that's kind of how we advise people.
Yep. Well, this is why we have you here, because it's helpful to just hear that kind of straight, like this is how we think about it. Ashlee, I know you have some pretty strong thoughts about that initial enrollment period too, and kind of where people at least should start and why.
Yes, I couldn't agree more with what Aaron shared about starting with original Medicare being a very prudent course of action for most people who are new entrants. And I think all of Aaron's advice and recommendations is spot on. Me personally, I had a client in her 80s who switched from a Medicare Advantage plan for all of the reasons Aaron mentioned. The plan, she couldn't get to the doctors that she wanted to see. Her doctor retired. The new doctor wasn't a great fit for her needs. And so in her 80s, she switched from an Advantage plan to original Medicare, and it was costly.
Yeah. Well, I know for me, these conversations that we've already had have been very helpful as I've been thinking about those kind of decisions that I'm going to have to make personally here in the next year or so. So when we get off that employer plan where the employer is probably participating and we're paying an amount of the premium, so it's kind of hard to tell just exactly how much maybe it's costing. But when we come into Medicare, it's going to, like you said, Ashlee, it will be a plan that we own and that we are paying all of the premium for. So Aaron, when we're kind of moving into that, what might we expect for costs in that first year or two?
Sure. Good question. So to go on to Medicare A is free. Doesn't cost any money in most cases. Medicare B is going to have a premium. For people that leaving out IRMA, that's kind of evil, IRMA.
That's not Kent's aunt.
No, that isn't.
Not
that's
Kent's
your
aunt
evil
IRMA.
Yes.
We'll come back to that, though.
Right.
We will come back to that.
So IRMA, we'll come back to that.
Yeah.
If you're not paying IRMA, you're at $202.90 to be a part of Medicare Part B. And remember that you're going to pay that $202 whether you're on Medicare, Medicare supplement or a Medicare Advantage. You're still paying that $202.90. And then from there, you're going to have a Medicare supplement. We are discussing average prices for a 65-year-old, probably somewhere, I would say, $120 to $160, depending on the carrier that you choose there, is an average cost. And then your Medicare Part D plan, your drug plan, anywhere from on the low end, there's a plan right now that's, I think, $5.75 approximately, up into the most expensive plan is maybe around $100, somewhere in there. If you're only taking generic meds, you can probably get away with spending less than $20. If you're on some serious name brand drugs, then a good agent's going to filter that and figure out it might actually be in your interest to spend more like $40 or $50 a month to overall lower your costs.
Your costs, yeah. So the cost of the drug plus the cost of the premium is still better to pay a little bit more premium.
Correct.
Because it's just got a better pricing on the drug.
Yeah.
Yeah. Okay. All right. You mentioned IRMA, and so we need to talk about it because I think people hear that and go, what exactly is that? So, Ashlee, what is it? When we talk about IRMA, and it's not my aunt, who or what are we talking about?
Yes. Well, earlier I mentioned that when Medicare is an individual health insurance policy, it comes with an income-based set of premiums. So Aaron's examples of costs are spot on. I would say for someone coming in when they're first 65, getting into Medicare, maybe $400 a month would be the base monthly premium per person. So $400 for spouse number one, $400 for spouse number two if they're both 65 plus. Medicare is means tested, so that means our Part B premium, which covers our medical things, doctor's office visits, outpatient treatments. That runs on a scale based on your modified adjusted gross income, which Aaron mentioned. And what's interesting about Medicare is that it's priced based on 2 years ago income. So Kent, when you go to shop for Medicare in 2026, your premiums for Part B and also Part D are going to depend on your income from 2024, 2 years prior. because that's really the most recent, readily available income information we have based on tax return data. So for a lot of people, especially new to retirement, just past 65, our first years on Medicare are going to be looking at income from a time when we were working and possibly at our peak earning season of life. So I always caution folks, when you're new to Medicare, you may have temporarily higher premiums because your costs are going to be driven by a time when you were working and earning full salary and benefits and compensation. So Part B, the hospital piece, is means tested. There's a tiered scale that you plot where you are 2 years ago income-wise. $202.90 per month is the base premium per person, and then it can rise all the way into the $600 mark per month for the very highest income earners. And so then in 2027, we'll be looking at 25 income. For 2028, we'll be looking at 2026 income and so forth. Part D, the drug piece, uses a very similar tiering system for premiums. There's a stated plan premium, $5 to $100 a month, as Aaron mentioned, but also possibly an income-related surcharge if you are a high earner. You have lots of investment income, farm or business income, you're still working part-time in retirement. All of those things get added up. So when we're planning for clients, it's very important to understand, if I'm going to be retiring soon, can I structure my income in a way that doesn't inadvertently push me over this IRMA cliff? Because even $1 past the next tier, and you're stuck in a higher cost scenario for the next 12 months until the prices are reset to that new 2 years prior income level. And if you're wondering, IRMA, it stands for Income Related Monthly Adjustment Amount, not your great aunt.
Okay. Well, this is the one that gets a lot of attention, especially I think as people are preparing to retire, because you're right, when you're getting ready to retire, oftentimes you're in your higher earning years, or if you're a business owner, there might even be some extra income from transition of a business. So planning for that income and kind of understanding what it might look like the first year versus what it might look like going forward.
You bet. An initial cost scenario for a newly minted retiree, 5 years down the road, it could be a totally different ballgame.
And is there anything you can do, let's say this is just a very unusual year.
Yes.
And when they look back at 2 years, Aaron, you're nodding your head. Is there something that we can do to say, hey, that's not my normal year?
Yes. If you did experience a blip, a temporarily high point in income, maybe you had capital gain from the sale of a business or a property, there is a form that you can file with the Medicare administration that says, that was an outlier, that's not my typical, adjust downward, please. And we have seen clients use that form with success before to just kind of normalize, throw out that outlier and base the premiums on the more
normal
traditional pattern of income and earnings.
Okay.
And as you might expect, the federal government doesn't really advertise that. So if you're working with a good agent or working with a foster group, that's another benefit that comes up, because oftentimes people don't know that they can file for that exemption. So I've seen people pay hundreds of dollars that they didn't need to pay simply because they didn't file that.
They didn't know
form.
that they could do that.
That's right. Okay. A well-kept secret makes a lot of sense to overturn every stone.
Mm-hmm. Yeah, absolutely. Well, it's just helpful information to have and to kind of be aware of for people moving into it. All right, last thing for today's discussion. I know this is true when people get ready to retire and they think about, hey, how I've been getting this paycheck in my bank. This is how I get money to live, and this is how things are paid for. And people are like, how am I going to replicate that paycheck experience in retirement? And so if you're an investment advisor, you help people understand, well, it's going to come out of these accounts and it's going to transfer into your checking account, and it's going to be great. Same kind of question with paying for health insurance. What are the mechanics for how health insurance or how Medicare gets paid for in retirement?
Yes. From a financial advisor perspective, again, kind of two lanes. Are you collecting Social Security or are you not? If you are collecting Social Security benefits when you're enrolling in Medicare, it's very common for Part B and Part D, the medical piece and the drug piece, to be automatically deducted from monthly Social Security benefits. So you might receive a few thousand a month, you back off those Medicare premiums each month, and then you get paid the net to your bank account or in a check. That works very well for our Medicare beneficiaries who are already collecting Social Security. If you're choosing to delay for whatever reason, then you can have Medicare premiums direct billed to you. So on a monthly, on a quarterly, on a semi-annually, on an annual basis, you can pick what works for you. You can do a bill in the mail and you write them a check, or you could just do the much easier option of direct debit from a bank account.
Yeah.
We see folks choose all kinds of different combinations there, but it is easy to pay for Medicare in retirement. Don't let that unfamiliar process cause you worry. A good advisor or agent is going to help you navigate the realities of how exactly do I cover this cost every month.
Yeah. Well, Ashlee and Aaron, thank you again for sharing your combined wisdom and experience with us. As I said at the beginning, I knew right away when we started talking about this topic that this conversation was going to be helpful and that I needed it too. You guys delivered. For any of you joining us live who have submitted questions during the webinar, we'll be answering those offline and get the responses to you directly. We'll also post those questions and answers to the show notes when we post the recording of this webinar in a week or so. So again, for myself, Ashlee, Aaron, and all of us at Foster Group, thanks again for joining us today.